Hi, this is Cassidy Marcette, and this is my final presentation for Psychology Senior Seminar for Colorado Christian University. This presentation is on gerontological psychology. What is gerontological psychology? Gerontology is the study of the age and processes and individuals as they grow from middle age through later life. It includes the study of physical, mental, and social changes in older people as they age, the investigation of the changes in society resulting from our aging population, the application of this knowledge to policies and procedures. As a result of the multidisciplinary focus of gerontology, professionals from diverse fields call themselves gerontologists. What do gerontological psychologists do? Gerontologists improve the quality of life and promote the well-being of persons as they age within their families, communities, and societies through research, education, and application of interdisciplinary knowledge of the aging process and aging populations. What jobs are available for those who study gerontological psychology? If you have an undergraduate degree, like a bachelor's degree, you can be a caseworker, community worker, disability policy worker, disability case manager, psychological stress evaluator, social services aide, veterans counselor, victims advocate. If you have a graduate's degree, such as a master's or doctorate degree, you can be a clinical psychologist, clinical social worker, cognitive psychologist, community psychologist, developmental psychologist, gerontological counselor, geropsychologist, and a medical social worker. What challenges do the elderly face? The elderly first face Alzheimer's disease and depression. What is Alzheimer's disease? Alzheimer's disease is a type of dementia that causes problems with memory, thinking, and behavior. Symptoms usually develop slowly and get worse over time, becoming severe enough to interfere with daily tasks. There are 3 stages of Alzheimer's disease: early stage, middle stage, and late stage. In the early stage of Alzheimer's, a person may function independently. He or she may still drive, work, and be part of social activities. Despite this, the person may feel as if he or she is having memory lapses, such as forgetting familiar words or the location of everyday objects. In the early stages of the disease, family and friends will notice their loved one is having problems coming up with the right word or name, trouble remembering names when introduced to new people, challenges performing tasks in social or work settings, forgetting material that one has just read, losing or misplacing a valuable object, and increasing trouble with planning and organization. The middle stage Alzheimer's is typically the longest stage and can last for many years. As the disease progresses, the person with Alzheimer's will require a greater level of care. People will notice these signs in middle stage Alzheimer's disease: forgetfulness of events or about one's own personal history, feeling moody or withdrawn, especially in socially or mentally challenging situations, being unable to recall their own address or telephone number or the high school or college from which they graduated, confusion about where they are or what day it is, the need for help choosing proper clothing for the season or the occasion, trouble controlling bladder and bowels in some individuals, change in sleep patterns such as sleeping during the day and becoming restless at night, an increased risk of wandering and becoming lost, personality and behavioral changes, including suspiciousness and delusions or compulsiveness, and repetitive behavior like hand-wringing or tissue shredding. The final stage of this disease, individuals lose the ability to respond to their environments, to carry on conversation, and eventually to control movement. They may still say words or phrases, but communicating pain becomes difficult. As memory and cognitive skills continue to worsen, significant personality changes may take place, and individuals may need extensive help with daily activities. Individuals may need round-the-clock assistance with daily activities and personal care, lose awareness of recent experiences as well as of their surroundings, experience changes in physical abilities including the ability to walk, sit, and eventually swallow, have increasing difficulty communicating, become vulnerable to infections, especially pneumonia. Statistics for 2017 were Alzheimer's disease is the sixth leading cause of death in the United States. Every 66 seconds, someone is diagnosed with Alzheimer's disease. More than 5 million Americans are living with Alzheimer's disease. Since the year 2000, deaths from Alzheimer's disease has increased 89%. In 2050, it is estimated that there will be 16 million suffering from Alzheimer's disease. 1 in 3 seniors dies from Alzheimer's disease or other dementias. In 2017, Alzheimer's and other dementias will cost the United States $259 billion. In 2050, it is estimated that Alzheimer's and other dementias will cost the United States $1.1 trillion. What you should know about depression in the elderly. Depression is not a normal part of growing older. Older adults may be going through changes, such as children moving away, illness, moving to assisted living facilities, or the death of a loved one. All of these things can cause feelings of sadness or grief, but when feelings of sadness and grief last for a significant length of time and keep older adults from enjoying their life the way they used to, it may be time to seek treatment. Recognize the signs of depression: prolonged sadness or unexplained crying spells, irritability, anger, worry, agitation, anxiety, feelings of guilt, worthlessness, lack of energy, problem sleeping, increased confusion, unexplained aches and pains, loss of appetite and weight. Physical challenges include low vision and blindness, such as macular degeneration, diabetic retinopathy, cataracts, and glaucoma. Loss of hearing includes tinnitus, ear disease, vertigo, Meniere's disease, etc. Arthritis includes bone loss, osteoporosis, Paget's disease, and autosclerosis, etc. Diabetes type 1, type 2, heart disease, coronary artery disease, cardiomyopathy, vascular heart disease, congenital heart disease, etc. Cancer, bladder, breast, colon, and rectal, endometrial, kidney, leukemia, lung, melanoma, etc. The scriptural aspect of this, taking care of the elderly, takes patience, kindness, wisdom, and love. What better way to end this presentation than quoting the love scriptures that the Apostle Paul wrote in 1 Corinthians 13, 4-8. Love is patient, love is kind. It does not envy, it does not boast, it is not proud, it does not dishonor others, it is not self-seeking, it is not easily angered, it keeps no records of wrongs. Love does not delight in evil, but rejoices with the truth. It always protects, always trusts, always hopes, always perseveres. Love never fails. I hope you have enjoyed this presentation, and I hope you learned a lot about taking care of the elderly. Thank you.